Okay. Thank you for joining us, everybody, Julia, for our third honors colloquium, I think, of the fall semester. So we are very excited to be welcoming one of our graduating seniors, Jordan Ragland, here. I just wanted to mention before we get started, for those of you who are interested, we do have at 2 p.m. a Zoom meeting with the director of the WIT program, which is to provide tutoring to students in foster care. So I sent that link out a couple times. If you want to attend, but somehow missed the link, you let me know and I can get it to you again. Don't worry about it. But anyhow, Jordan is going to be talking to us on a project she worked on with Dr. Torben. And as you can see, it is exoskeleton use in lower extremity injury and limb salvage, which is the sum total of my understanding of what she's about to talk about. So I will be quiet and I will turn it over to Jordan. If you haven't signed in, please do so before you go. Feel free to grab some food and take it away, Jordan. Thank you.
Thank y'all for coming.
And yes, you should be able to move it by touching the screen, they tell me. There we go.
There it is.
There it is. Yep.
Okay, so what is an exoskeleton? An exoskeleton is a wearable device that helps improve functional mobility. It's a technological augmentation. You have a passive, which provides support and stability, and then an active, which is powered and helps amplify strength and endurance. So there's a long history of exoskeletons. Research for lower limb exoskeletons dates back up to 200 years ago. The evolution has definitely progressed over time. And in the recent years, there's been a high increase of interest in the use of exoskeletons. The military has conducted extensive research into them for soldiers on the battlefield as well. So you have exoskeletons that are used for medical rehabilitation and also ones that are used in the battlefield. So for medical rehabilitation, the design is focused on the flexion and extension of each joint. And then the design is also based on the basic configuration of reproducing the human motion as well. And then it assists with lower limb injuries to move independently. It redirects loads around an injured limb to proximal tissues and to stabilize the joints. Redistributing loads away from the injury prevents exacerbation and reduces pain as well. So you have a Gastillo type 2 and type 3 long bone fracture. This is the type of fracture that occurs in the tibia or femur. A type 2 is going to have a wound that's 1 to 10 centimeters with a moderate injury. And then your type 3 fractures have a wound greater than 10 centimeters with an extensive soft tissue injury. It is often seen in high energy trauma, such as gunshots, combat blasts, and car accidents. It usually requires surgical intervention and wound care to prevent infection. And then it can require vascular reconstruction, which helps determine if they're going to amputate or not as well. Military has been looking at using exoskeletons in these injuries for harsh environments. Removing an injured soldier from the battlefield takes a lot of people to do so, and it can prevent different things that need to happen in the battlefield. So getting them off this rugged terrain has been a difficult issue. It can help restore mobility to someone with a long bone fracture, and the devices would need to be durable to withstand these conditions as well. These are different types of exoskeletons that are used in a military environment. Those are just some pictures of examples. There's different types of exoskeletons. You have a powered lower limb assisted exoskeleton, which helps people to load, enhances human strength, and reduces metabolic injury for the energy of lower limbs. Then you have a multi-joint assisted exoskeleton, which can reduce the injury of weight-bearing injuries and ambulation. Then you have an unpowered lower limb exoskeleton, which is used for medical rehabilitation, human motion assistance, and load enhancement. Then the military has invested significant resources in unpowered lower limb assisted joints because the environments they're in, you can't always have a powered device. Because when you're in a battlefield for a long period of time, you can't always have access to a battery or a power source. And then they're looking at principles such as passive, flexible, and elastic joints, and then a mechanical skeleton and human energy collection devices as well. This is an example of a powered limb exoskeleton. It has an active knee and hip joint, a passive ankle joint, air pressure sensors, and a control board and battery. Then this is an example of a multi-joint assisted exoskeleton. You're going to see these a lot in rehab purposes in a rehabilitation hospital. Then an unpowered lower limb assisted exoskeleton. One of these examples is a walking boot, which they're going to use in an instance of a high ankle sprain or a fracture that weight bearing is allowed. And then for rehabilitation purpose, it provides resistance to interfere with the patient's movement to achieve a therapeutic exercise. And then it focuses on improving mobility and function after musculoskeletal injuries. And then the patient requires a combination of systematic, scientific, and targeted treatment for various stages of recovery of the injury. This is some examples of how they use exoskeletons. So in a lot of rehabs, they have different harnesses or different things that can hold a patient up while they're trying to get them to walk if it's more than what one person can handle. High energy lower limb extremity trauma. This is very prevalent in the US military. It can be challenging in terms of whether to amputate or salvage a limb. Military resources are invested in the development of orthotic and rehabilitative technology. One of the main ones they're looking at is an intrepid dynamic exoskeleton orthosis, or IDEO, which is an energy storing carbon fiber orthosis designed to improve gait, stability, and function. Studies show it improves functional performance and can lead to reduced rates of a delayed amputation. So when using this phrase, they've been able to salvage up to 80% of limbs from amputation. And then with extensive rehabilitation, 65% of these wounded veterans have been able to return to active duty as well. Then the conclusion, an exoskeleton designs require knowledge about design, engineering, and rehabilitation. Multidisciplinary research on exoskeletons should focus on biomedicine, bionics, materials, science, engineering, robotics, and artificial intelligence. Designs continue to improve and evolve over time, and exoskeletons provide promising results for rehabilitation. Does anyone have any questions?
Okay, first off, thank you. Well done. Well, yes, questions? We should have some time, certainly for that. I've got a few, but I will defer to the audience. First up.
Okay. No.
All right. One thing I forgot to mention is that you're thinking about going into physical therapy, right? Is there a particular application of these exoskeletons that you want to kind of pursue, you want to focus on specifically, or?
I definitely think using them in the military and the VA research on them is a very interesting application of them because they're saving limbs that in most instances are going to be amputated. And a lot of these are also being able to return to active duty as well.
Yeah. Other questions?
Okay.
How close do you think researchers are to perfecting a bionic knee or knee replacement?
That's a hard question. I didn't look at that as much, if I'm being honest. I mainly looked at just the lower limb. So like your ankles. I mean, there's some knee stuff in there, but it's very limited to what I looked at. So that's kind of a hard question to answer.
I look at knee surgery down the road at some point, so it's kind of holding out for my knee.
Yeah. Is most of the exoskeleton research on lower limbs, or is it pretty equally distributed across the body in the whole field?
There's a lot on lower limbs.
Yeah.
But I think there's some in upper body, but it's mainly lower limbs.
Yeah. And my interaction with it is mostly in the sci-fi sense when I used to teach my futurism class, that this was the future, that yes, we'd all be in like bionic stuff. So I'm excited that possibly dystopia is coming, but this sounds hot and I like it. Yeah. We're gonna use this for good. Other questions?
I can. Right now.
Oh, I'm sorry, Sam. I wasn't looking at it.
The models of exoskeletons that you were bringing up for military use, are those just specifically being developed for the military, or is it also going to be that they're going to be widespread for civilian use?
So those are mainly for like an austere environment. So your rugged conditions. Now they can be used in any environment, but you see them mainly and prevalently in the military.
Oh, okay. Would that also then apply to other strenuous fields like firefighters and paramedics and so on?
Yes.
Okay.
Any other official questions? Fine. Okay, in that case, we will say thank you again to Jordan. Well done. We do have some time, if you want to, I'll end the recording now that the formal process is over. But we do have some time if you want to hang about and chat with her a little bit more about this, if you want to grab some more pizza and such. And we will approach it as a discussion style as well. But thank you, very interesting. Cool stuff. Thank you, Zoom friends. I'll go ahead and end the recording if I can find that's awesome.
Well, that is.